Hello, I'm Kristin Bennett from Rensselaer Polytechnic Institute, and today I'm going to talk to you about Mortality Minder, a web tool for visualizing and investigating social determinants of premature mortality in the United States. This is work of myself, John Erickson, Lillian Negueta, Karen Bano, and students in the Data Insight Lab. After this session, you'll be able to utilize the Mortality Minder app to understand the trends of premature mortality rates in the United States at the county, state, and national levels. You'll be able to apply Mortality Minder to gain insights into social and economic determinants of premature mortality for deaths of despair and other causes of death. And you'll understand how the Mortality Minder framework can be adapted to understand COVID-19 mortality. I don't have anything to disclose other than the fact that this work was partially supported by the United Health Foundation. So this talk is about Mortality Minder, which is an app that won 3rd place in the ARC Visualization Resources of Community Level Social Determinants of Health Challenge. So we're going to start by playing a video we made for that challenge, and then we'll go into some of the scientific details of the methods that are used underneath.
Mortality rates are going up in the United States, and we need to figure out what to do about it. So we've built an app to help understand mortality and the factors behind it at the national, county, and state levels. The app works by examining data for the Centers of Disease Control. Here we're looking at deaths of despair. These are deaths due to suicide, overdose, substance abuse, and poisoning, basically self-harm. And here we're going to look at the rates in the United States by county. And we can look through time. Here it's light, there's not too much of the deaths of despair. And as we move through time, we can see it gets worse and worse and worse and worse until we get to 2015, 2017. And here we can see that there are large areas of the United States that are experiencing high rates of mortality. If we look over here, we can see a curve that shows the mortality rate in the nation through time. And we can see that it has risen over 90% in less than 20 years. Mortality Minder is an interactive presentation, so we can dig down into details of why this is happening by moving to the next page. So here we can see we can divide the counties into different risk groups. So we have 6 different risk groups. And these represent the curves for those risk groups. So we can see that some counties are doing extremely well, while other counties have increased risk, where these dramatically bad ones here having the highest rates. And then we can look at, based on those, we can look at socioeconomic factors which are associated with these dramatic increases in mortality. So here we can see the top factors for deaths of despair in the United States are being mentally unhealthy, having frequent mental distress, being physically unhealthy, and being unemployed. To further understand, we can examine what's happening at the state level. You can select states that you're interested. I'm going to go to the state of Ohio. And here we can see in Ohio that we have high-risk areas in the Ohio Valley and better risk up here. And you can see here that the best areas in Ohio are actually much better than the state and the national average, which is shown in blue. But we have these counties that have had almost a 3-fold increase of deaths of despair. So we can again look at the factors determining them. And here we can see that single-parent households is a top contributing factor, while home ownership is protective. Mortality Minder enables individualized view from a state's perspective. So let's look at another state, California. If we look at California, we can see that there's different risk groups, and if we look at a county here like Los Angeles, we can see that it's in this low risk group, and that's actually Los Angeles' mortality rate. It's very, very good and flat. And we can look at a high risk group like Humboldt County up here, and we can see that it's much, much higher. And this is the national average. Much of California is doing better, but some places are doing very poorly. And if we ask why, we can look at the associated social and economic factors. And we see that having food insecurity, being rural, being a non-Hispanic white, being mentally unhealthy, all contribute to deaths of despair, and having good access to food helps. If we want to drill down into more detail, we can either swipe to the next page or hit the caret, or we can pick one of these factors. And then we get the definition of the factor, and its source. This is from Mind the Meal Gap, and we got this originally from County Health Rankings. We can see the correlation and significance. And we can also look at individual counties. If we look here, we can see individual counties plotted, and you can see they're colored by the risk group. This is the mortality rate. This is the food insecurity. And you can see this is a clear upward trend. This is also represented in box plots that show the distribution for low, medium, and high risk counties.
This entire analysis can be repeated for other causes of death.
If we move to the next page, we get a full description of what's going on here, including the ability to download the source data and download the current results. This app is an open source app written in R. It's available on GitHub, and there is a wiki that fully documents all features of the app.
Mortality Minder was created by students in the Health Analytics Challenge Lab at Rensselaer Polytechnic Institute with generous support from the United Health Foundation and the Rensselaer IDEA. Our hope is that this app will enable healthcare organizations and policymakers to understand the determinants of mortality to improve longevity in the United States. Mortality Minder works by clustering the counties into risk groups. Each county is represented by its mortality rates between 2000 and 2017 and clustered into a high, medium, or low risk groups using k-means clustering. The map shows that the highest risk counties, shown in red, occur mainly in southern Ohio in Appalachia. The left plot shows the average rates of deaths of despair for each risk group. We can see that the lowest risk counties, shown in yellow, do better than the national average, shown in blue. The highest risk counties have had over a threefold increase in deaths of despair. The mortality rate data was collected from CDC Wonder. It was for the years 2000 to 2017, which were all the years that were available when we made it. We used selected crude midlife mortality rate data for adults ages 25 to 64, calculated at the county level. This is because we want to demonstrate premature mortality rates actually experienced by Americans in a county. The mortality rates were done in 3-year chunks, so we avoided suppression of data as much as possible. If data was suppressed, we used multiple techniques for imputing them. We use national, state, and county rates for major causes of death, which consisted of all causes, cardiovascular disease, cancer, and deaths of despair. Why do we have such dramatic increases in deaths of despair in Ohio? The plot on the right examines factors associated with deaths of despair in Ohio. These factors are potential social determinants of health. We examined over 150 social and economic factors gathered by Counting Health Rankings under the sponsorship of the Roberts Wood Johnson Foundation. These factors include health behaviors such as tobacco use, diet and exercise, alcohol and drug use, sexual activity, clinical care, access to care, quality of care, social and economic factors such as education, employment, income, family and social support, and community safety, physical and environmental factors that capture air and water quality, and housing and transit. The hope is that if we can find these potential factors associated with mortality, we can develop policies and programs that influence them, and these will in turn lead to better health outcomes such as length of life and quality of life. We performed an association study to find potential determinants of mortality. We ordered the counties by risk groups using the 2015-2017 mortality rate. We computed the Kendall-Tau correlation between the factors and the risk groups. We reported the 15 most significantly associated factors using a p-value of 0.05 with correction for multiple hypothesis testing. This method was chosen because it worked robustly across all the different choices of causes of death in states. Other analysis methods could easily be adapted thanks to our open source architecture. Now let's examine the potential determinants of deaths of despair in Ohio. We first see that counties that have higher rates of families in distress experience greater rates of deaths of despair. Destructive factors indicated in red include single-parent households, low birth weight babies, and teen birth rates, and children in poverty. Socioeconomic factors are associated with increased rates of deaths of despair. Destructive factors include severe housing costs, socioeconomic disparity, and food insecurity. We also see protective associations shown in blue, such as good access to healthy food and home ownership. Racial disparities may exacerbate deaths of despair. In Ohio, counties with higher rates of African Americans have higher rates of deaths of despair. We also see that poor access to mental health care providers and primary care providers is associated with increased deaths of despair. And finally, communities with higher rates of violent crime experience more deaths of despair. Users can use the factor view to learn more about any factor. This view addresses the question, how are county-level social and economic factors associated with midlife mortality rates for deaths of despair in Ohio? Users can select a factor using the drop-down menu or by clicking on the plot. Then they can dive into the details. The user can see a definition of the factor, an explanation of how it affects its health, and the results of the analysis, as well as the source of the data. Graphs, such as the box plots, show the distribution of the factor for each risk group. Here we can see that communities with low rates of single-parent households have less rates of deaths of despair. The explanation shows that adults and children in single-parent homes are at more risk for mental illness and unhealthy use of drugs and alcohol. So helping single-parent households could help decrease deaths of despair. This analysis can be done for other types of deaths, including all-cause cancer and cardiovascular disease. Here, the user has selected cardiovascular disease from the drop-down menu. In general, mortality rates from cardiovascular disease have been declining in the United States for over 100 years. But in 2009, during the Great Recession, this trend was reversed and they started to rise. To understand why this is, we can do an analysis of social determinants at the national level by picking the United States from the drop-down menu. For the United States analysis, we calculate 6 risk groups to represent the greater diversity observed in the epicurves across the 3,000 counties. We can see that the southern United States has much higher rates of premature death from cardiovascular disease. Looking at the epicurves, we see that there was a great disparity in death rates between counties in 2000, and these disparities have been exacerbated since then, especially after 2009. Not surprisingly, we see known risk factors for cardiovascular disease, diabetes, smoking, and physical inactivity. We also see that counties with children in poverty, food insecurity, and high teen birth rates have higher rates of cardiovascular disease mortality. We see that counties with higher incomes have less cardiovascular disease. Curiously, excessive drinking is negatively associated with mortality, but don't start drinking. This is probably not a causal relationship. COVID-19 is now a leading cause of death in the United States. Like the other causes of deaths we saw before, counties experience COVID at different rates. We applied the same analysis that was used in Mortality Minder to daily COVID mortality rates from March to September. The rates were smoothed by taking 7-day average. The data came from Johns Hopkins. Here we see the results from Ohio. We can see that some counties had much higher risk than others. We examined the factors associated with COVID-19 risk in Ohio. Social associations was the most destructive factor. Social associations are things like the rate of membership in churches and clubs. Typically, social connectivity is associated with better health, but in this case, they might have contributed to COVID transmission. Segregation, Hispanic population, lack of access to healthcare were associated with more mortality. Rural populations and younger populations fared better. Poor air quality is associated with higher COVID mortality, a fact that has been noted in other studies. We are currently including the capability to analyze social determinants of COVID in our app, COVID Minder. COVID Minder monitors daily case and mortality rates. COVID Minder will be able to provide analysis of social determinants at different periods of the pandemic. One of the important contributions of mortality is that it allows healthcare providers, payers, and policymakers to do analysis specific to the regions and interests. Here we compare the analyses of deaths of despair for the U.S., Ohio, and Arizona. The 3 analyses show common trends. Deaths of despair are associated with poor mental and physical health, and lack of access to mental and physical health care. Deaths of despair are probably exacerbated by economic distress and food insecurity. We also see in ways that these analyses are different. In the United States overall analysis, both here and in prior studies, deaths of despair have been associated with rural, non-Hispanic white populations. But if we examine Ohio and Arizona, we see different patterns in racial disparity. In Ohio, we see that African American communities have experienced more death. In Arizona, higher death rates are associated with segregated communities and those with higher American Indian populations. We've shown how you can use county-level surveillance data to provide insights into the social determinants of mortality. Mortality Minder enabled us to document the long-term rise in premature mortality in the U.S. pre-COVID and the factors associated with this rise. It provides insight into possible remedies, but is not a causal analysis. We know that COVID-19 is exacerbating the social determinants of deaths of despair and other causes of deaths, so we expect increases in premature mortality from many causes of death after COVID-19, and in fact, these have been observed. The same analysis can be applied to the social determinants of COVID-19 mortality. The final page provides full details of the app. All the data analysis results can be downloaded. Mortality Minder is entirely written in R, an open source language. It uses R Shiny and full-page JavaScript frameworks for web activities. Full details of Mortality Minder are described on the Mortality Minder wiki on GitHub. Mortality Minder is an open source project, and we invite future collaborations. There are two public deployments of Mortality Minder at these two links. We have this video and other videos available. Mortality Minder is completely open source. You can look at it in GitHub. We welcome your participation. You can report issues. Full documentation is provided on GitHub. And we'd like to say that Mortality Minder was created by undergraduate and graduate students in the Health Analytics Challenge Lab at Rensselaer Polytechnic Institute with support from United Health Foundation. We also want to thank our Mortality Minder Advisory Board, Ms. Ann Yao from United Health, Dan Fabius from Continuum Health, Melissa Kemal for the New York State Department of Health, and Dr. Tom White from Capital District's Physicians Health Plan. Thank you for your time, and I'll take any questions now.